bowel injuries can happen as the result of abdominal surgeries. What types of things during surgery can actually cause those bowel injuries that our clients suffer?
Well, typically, the phone calls we'll get are from women after a hysterectomy. And so you say to yourself, well, how does the bowel get hurt? Well, the doctors are working in the area to remove the uterus and other parts of the female anatomy. And the bowel must be moved out of the way from the surgical field. So we see several ways the bowel gets hurt. One is in a laparoscopic surgery, there's a trocar that goes through the woman's abdomen, and it's called a blind entry. And if the doctor isn't careful, they can push that trocar too far, cause an injury right at the beginning of the hysterectomy. Another way is once the doctor is removing the uterus, cutting it away, they use surgical tools that can cut and ligate. And if they're not careful with that tool, they can accidentally burn or cut the bowel. Another way we've seen is sometimes there's a device called a morcellator, and a morcellator chops up the uterus, and they use the morcellator to remove pieces of the uterus through a shaft. Well, that morcellator chops up tissue, and if it's pushed too far, it can also damage the bowel. So these are some of the ways. All of them can constitute medical negligence. It depends on the case.
Thank you, Rick.